happy Thursday. Hi, Dr. Jeff.
Hi, Lily. How are you doing?
Good. I'm doing good. How are you doing?
I'm doing well. Things are good.
So this is another live session with Dr. Jeff here at Smart Plastic Surgery. So if you have any questions for him, you can put it here on the box, and we're going to answer some of the questions that you already posted on Instagram. And we have Maya Malin. Can you do blepharoplasty with BBL and lipo?
Absolutely. Well, the one thing you can't do is BBL without lipo. Okay, so we always do the BBL with the lipo.
Yes.
And can we do blepharoplasty? Yes, we've done, I do many facial procedures with tummy tucks, with BBL, so we can make those combinations without a problem. So if that's what you're interested in, sure, we could do that.
Why is so common that confusion about lipo and BBL?
I don't know, right? I don't know, but patients sometimes ask, can you do BBL with lipo? And I don't know why that is. It's just about understanding the procedure, okay? Because we're not taking the fat off a shelf, we're taking it from the person, from the patient themselves. So that's going to improve the contour because of the liposuction. Then we're going to transfer it, to the buttock region to create the BBL. So it's always with lipo.
It's a combined procedure.
It's a combined procedure. We could do lipo without the BBL, but we cannot do BBL without the lipo.
Yes, because where are you going to get the fat, right?
Exactly.
So I think the confusion comes because probably people think a BBL could be like implants too.
It could be, but it's not.
It's not a BBL.
No, because we would refer to that as an augmentation.
Yes.
Okay, so the BBL procedure, everyone should understand that's the Brazilian butt lift, and that's a misnomer also. Patangi, very famous plastic surgeon who developed this many years ago in Brazil. All right, he passed away a few years ago in his 90s. Wonderful surgeon, wonderful person.
Did you meet him?
I did many years ago.
Personally?
I did.
Oh, wow.
Wonderful person. So he came up with the term BBL. So there's not really a lift. I mean, you can get a lift from some of the fat. You're really getting more projection, and you are getting a lift, but you're not actually doing a lift, like a breast lift. That's a lift. He should have called it a BBA, because it's really a Brazilian butt augmentation, and we're augmenting it with the fat. But that's okay. I'm not going to criticize. All right. But the confusion is that if you do an implant, which I don't think is a good procedure for a buttock augmentation, I think fat is best for that area. I think an implant is best for the breast. But nonetheless, the BBL is purely fat, and an implant would be an augmentation procedure.
Oh, very good.
It's good to clarify those. A lot of confusion.
I'm curious about your encounter with Dr. What is his name?
Patangi.
Patangi.
Oh, you're very, charming, clever, brilliant surgeon. Yeah. So,
do you know how he developed that technique, or?
I think it was just an epiphany. He said, doing all this liposuction, of course, the person who developed liposuction was Luz, a gynecologist from France.
Oh, wow.
And he was actually doing other types of procedures that warranted suction, abortion procedures and things like that. Yes, so that's where it started. And he said, wait a second, it might be more productive for his career to start doing liposuction. So he developed that technique back in the 70s.
He's still alive?
He was a few years ago. I saw him in a meeting probably in his 80s. But that was probably like 10 years ago. Yeah.
Wow.
Yep, and he actually, since you mentioned it, very, very colorful guy. So he got up with his slides that were like decades old, yellowing slides. And the first slide, I still remember, this was probably 20 years ago that I saw this man. It was at the American Society of Plastic Surgeons meeting, and his first slide, it was all about liposuction, of course, said the liposuction is a blind procedure, but the patient is not blind. All right, so what that means, it's technically a blind procedure because we don't have a camera on the cannula, right? So we go through the small opening right there, like a quarter of an inch. They're really tiny incisions we use, and we insert the cannula. We know where we are. Yes, we know where we are. Like for a BBL, we know where we are. We use ultrasound to check the position of the cannula, but the cannula itself is going into the fatty compartment. So technically, it's a blind procedure.
Interesting.
But the patient is not blind.
Exactly.
And what he means there is they're going to see the results.
Patients,
exactly. So that was a brilliant first slide, and everybody loved it. But he was right. So that's why we're very meticulous about what we do with our liposuction techniques, so we don't get, complications, irregularities. But of course, everyone has that occur occasionally. But basically, you're always thinking you don't want to get depressions, irregularities, any of that. You want to get and I tell patients, it's not an ironing board, so we're not ironing, right? But nonetheless, we're trying, right? We're trying to get the smoothest results and the smoothest contours possible.
That's great,
But that was Patangi, and that was Iluz.
I like who are
Very
you hanging out
interesting
with?
I don't know. I wasn't actually hanging out with a Luz in his 80s, but nonetheless, colorful guy.
Wow.
Yep.
Thank you for that. This is another question. Hi, do you do endoscopic brow lifts?
So I used to do endoscopic, but now there's a really a better technique in the sense it's a lateral brow lift. And what it does is really raise, like just the lateral, you have perfect brows. It raises really the lateral third of the brow. All right, that's the area you want to just bring it. Yours is fine, but you would want to bring that up just slightly. You don't want to raise the middle portion because then you look like a clown.
Oh, wow.
Right, so you want to raise really the lateral third.
Okay.
And many years ago, people would do coronal brow lifts and make an incision all the way across at the hairline and lift the entire forehead, or make several incisions, 3, and use a scope to come all the way down to this area here and remove the muscle from that area.